Are you ready to unlock the hidden truths of your mind and body? Discover the groundbreaking insights that will change the way you understand trauma and its profound effects on your life. In The Body Keeps the Score, renowned trauma expert Bessel Kolk MD takes you on an eye-opening journey into the depths of the human psyche. This book reveals how trauma rewires your brain, impacts your emotions, and alters your body's responses. With compelling stories, cutting-edge research, and powerful therapeutic techniques, Kolk offers a revolutionary approach to healing that has transformed countless lives. Whether you've experienced trauma yourself or want to understand its impact on loved ones, this book is an essential guide to reclaiming your life and finding true inner peace. Get ready to embark on a life-changing exploration of the science and stories behind trauma as The Body Keeps the Score audiobook begins now. Understanding Trauma, the lasting impact on brain, mind, and body. Trauma is not limited to combat zones or refugee camps. It affects people everywhere. Research reveals alarming statistics about the prevalence of childhood abuse and domestic violence in the United States. Despite human resilience, traumatic experiences leave deep imprints on our minds, emotions, and even our biology. Trauma affects not just the victims, but also those around them, disrupting families and relationships. Trauma is inherently unbearable. Victims of rape, combat soldiers, and abused children often try to suppress their memories to cope. However, our brain's survival mechanism cannot easily deny these experiences. Traumatic memories can resurface at the slightest trigger, causing overwhelming emotions and physical reactions. Survivors often feel damaged and beyond redemption due to these uncontrollable responses. The author's journey into studying trauma began with a fascination for medicine and the human body. Psychiatry, however, highlighted the profound complexities of the mind and human connections, contrasting sharply with the knowledge of other bodily systems. The emergence of neuroscience, developmental psychopathology, and interpersonal neurobiology has revolutionized our understanding of trauma. These fields have shown that trauma induces physiological changes, such as an overactive brain alarm system and increased stress hormones, which compromise the brain's ability to filter relevant information. These changes explain the hypervigilance and repetitive behaviors seen in traumatized individuals. The significant increase in knowledge about trauma has led to new possibilities for healing. Techniques that leverage the brain's neuroplasticity can help survivors regain a sense of aliveness and move forward. Healing approaches include talking and reconnecting with others, medications to manage alarm reactions, and physical experiences that counteract feelings of helplessness. The author, supported by colleagues and students at the Trauma Center, has dedicated his career to treating traumatized individuals and researching effective treatments. The goal is to help people regain control over their lives and overcome the imprints of past trauma. Through decades of work, the author has observed that while human connections and understanding can aid healing, physical experiences that directly contradict the helplessness of trauma are crucial for regaining self-mastery. This book serves as a guide and an invitation to address trauma, explore treatment options, and commit to prevention and recovery as a society. Lessons from Vietnam Veterans: The Quest to Understand Trauma. In the late 1970s, a new psychiatrist at the Boston Veterans Administration Clinic encountered his first Vietnam veteran patient, Tom, who was plagued by nightmares, flashbacks, and uncontrollable rages. Tom's story was strikingly familiar to the psychiatrist, who grew up in post-war Holland with a father and uncle haunted by their wartime experiences. These veterans struggled with memories that kept them from living normal lives, revealing the profound impact of trauma on individuals. Tom's loyalty to his fallen comrades prevented him from taking medication to alleviate his nightmares. He felt that forgetting them would betray their memory. This profound sense of duty and the subsequent emotional turmoil led the psychiatrist to realize that trauma was not just about bad memories, but a complex condition that traps individuals in the past. The psychiatrist's early experiences with Vietnam veterans exposed him to the severity of trauma. Veterans often reacted with extreme rage to minor frustrations, a behavior that was both alarming and intriguing. This contrasted sharply with the developmental tantrums of his young children, who would eventually outgrow their immature behavior. He was skeptical about whether these veterans could relearn self-regulation and self-control. In search of answers, the psychiatrist delved into literature about wartime trauma and found that the symptoms described by World War I veterans mirrored those of his patients. This condition, known then as traumatic neuroses, had a physiological basis, reinforcing the idea that trauma is not merely a psychological issue, but a bodily response to overwhelming experiences. A pivotal moment came when he read about learned helplessness in animals, a condition induced by inescapable shock. The animals, unable to avoid painful stimuli, became passive and did not attempt to escape even when given the opportunity. This mirrored the behavior of traumatized individuals who, despite opportunities to move forward, remain stuck in their past experiences. The research also showed that trauma affects the body's stress hormone system, causing prolonged agitation and panic. This understanding led to the development of group therapy sessions for veterans. Initially resistant to discussing their experiences, the veterans found solace in sharing their stories with others who understood their pain. However, the sessions revealed the limits of group therapy, as veterans often reverted to discussing their traumatic experiences rather than addressing current life challenges. This highlighted how trauma can become the sole source of meaning in their lives, making it difficult to reconnect with the present. The creation of the PTSD diagnosis in 1980 marked a significant shift in understanding trauma. This new framework helped the psychiatrist and his colleagues to recognize the common symptoms among traumatized individuals, leading to more effective treatments. Despite the initial resistance from institutions like the Veterans Administration, this diagnosis paved the way for extensive research and new therapeutic approaches. As the psychiatrist transitioned to a new role at the Massachusetts Mental Health Center, he noticed similar trauma symptoms in patients who had experienced childhood abuse. This expanded his understanding that trauma is not exclusive to war veterans, but prevalent among many who have faced violence and neglect. Over the next 3 decades, advances in brain imaging technology and a deeper understanding of trauma's impact on the body and mind have transformed how we treat traumatized individuals. It is now clear that trauma fundamentally reorganizes how we perceive and interact with the world. Healing requires more than just talking about the past. It involves helping the body to live in the present. This comprehensive approach to trauma treatment underscores the importance of integrating new scientific insights into therapeutic practices, aiming to restore a sense of control and normalcy to the lives of trauma survivors. Revolutions in understanding mind and brain. In the late 1960s, the field of psychiatry underwent a significant transformation, shifting from a focus on psychotherapy to an increasing reliance on medication to treat mental illness. This change was influenced by the discovery of chlorpromazine, a drug that could tranquilize patients and reduce symptoms of severe mental disorders like schizophrenia. This shift promised a new approach to managing mental illness, moving away from the traditional talking cure rooted in Freudian psychoanalysis. During his time as a medical student and later as a young doctor, the author witnessed the stark differences between the old and new paradigms of psychiatric treatment. While working on a research ward at the Massachusetts Mental Health Center, he observed that the patients, many of whom were young and had suffered their first mental breakdowns, displayed a range of disturbing behaviors and symptoms. These included violent outbursts, self-harm, and catatonia. Despite their severe symptoms, the patients often revealed traumatic histories during late-night conversations, stories that were rarely addressed in formal treatment. This discrepancy between patients' experiences and the clinical focus on managing symptoms rather than understanding their causes troubled the author. He found that the standard psychiatric approach often overlooked the impact of trauma, focusing instead on categorizing symptoms and prescribing medications. This approach seemed inadequate, especially when dealing with patients who had experienced severe abuse or violence. A significant moment in the author's career came when he read Eugen Bleuler's Dementia Praecox, which described the hallucinatory experiences of schizophrenic patients in terms that suggested these might be fragmented memories of real events rather than purely pathological creations. This insight led the author to question the prevailing understanding of hallucinations and trauma, and to consider the possibility that many psychiatric symptoms could be rooted in past traumatic experiences. The author's training under Elvin Semrod at the Massachusetts Mental Health Center further shaped his understanding of trauma and mental illness. Semrod emphasized the importance of acknowledging and experiencing the realities of life, including its heartbreaks and pleasures. He taught that healing requires confronting and feeling one's emotions rather than merely managing symptoms with medication. This approach contrasted sharply with the growing trend in psychiatry to treat mental illness as a brain disorder that could be corrected with drugs. Despite his initial enthusiasm for the pharmacological revolution, the author became increasingly disillusioned with the limitations of drug treatments. He observed that while medications could alleviate some symptoms, they often left patients feeling numb and disconnected from their emotions and experiences. This realization led him to explore alternative approaches to understanding and treating trauma. One of the most influential discoveries during this period was the concept of learned helplessness, developed by researchers Stephen Mayer and Martin Seligman. Their experiments with dogs showed that animals subjected to inescapable shock eventually gave up trying to escape, even when they were later given the opportunity. This research provided a powerful analogy for human trauma, suggesting that people who experience overwhelming stress may similarly become passive and unable to take action to improve their situation. The author's exploration of the biological underpinnings of trauma revealed that traumatic experiences can cause lasting changes in the brain's stress hormone system. Studies showed that traumatized individuals often have elevated levels of stress hormones, which contribute to their ongoing agitation and inability to return to a state of calm after the threat has passed. This biological perspective reinforced the idea that trauma is not just a psychological issue, but a physiological one as well. Over the years, advances in neuroscience and brain imaging have deepened our understanding of how trauma affects the brain and body. These technologies have shown that trauma can alter brain structures and functions, leading to changes in how individuals process emotions and memories. This growing body of knowledge has opened up new avenues for treatment, emphasizing the importance of integrating physical experiences that can help restore a sense of control and safety. The author's journey through the evolving field of psychiatry highlights the importance of a comprehensive approach to mental health. By acknowledging the complex interplay between brain, mind, and body, and by recognizing the profound impact of trauma, we can develop more effective strategies for helping individuals heal and reclaim their lives. This holistic understanding is essential for addressing the deep and lasting effects of trauma on human well-being. Looking into the brain, the neuroscience revolution. The exploration of trauma took a significant leap with the advent of neuroscience, providing deeper insights into how traumatic experiences alter brain function and structure. This chapter delves into the revolutionary discoveries that have transformed our understanding of the brain and its response to trauma. In the 1980s, the development of brain imaging technologies such as positron emission tomography, PT, and later functional magnetic resonance imaging, fMRI, allowed researchers to observe the living brain in action. These tools revealed how different areas of the brain are activated during various tasks and emotional states, offering a window into the neural underpinnings of trauma. One of the key findings was the role of the amygdala, a small, almond-shaped structure deep within the brain in processing fear and threat. When individuals are exposed to traumatic stimuli, the amygdala becomes hyperactive, triggering the release of stress hormones like cortisol and adrenaline. This response is part of the body's natural fight or flight mechanism, designed to protect us from danger. However, in traumatized individuals, the amygdala can become overly sensitive, leading to exaggerated fear responses even in safe situations. Research also highlighted the impact of trauma on the prefrontal cortex, the brain region responsible for executive functions such as decision-making, impulse control, and emotional regulation. Traumatic experiences can impair the prefrontal cortex's ability to modulate the amygdala's responses, resulting in a diminished capacity to regulate emotions and reactions. This imbalance between the amygdala and the prefrontal cortex is a hallmark of post-traumatic stress disorder, PTSD, explaining why survivors often feel out of control and hypervigilant. Another critical area affected by trauma is the hippocampus, which plays a vital role in memory formation and retrieval. Chronic stress and trauma can lead to a reduction in the size of the hippocampus, impairing the ability to form new memories and integrate them into a coherent narrative. This disruption contributes to the fragmented and intrusive memories characteristic of PTSD. The body's stress response involves not just the brain, but a complex interaction with the entire nervous system. The autonomic nervous system, which regulates bodily functions such as heart rate and digestion, is divided into the sympathetic and parasympathetic branches. Trauma can cause a persistent state of sympathetic arousal, leading to symptoms like hypervigilance, insomnia, and anxiety. Conversely, some individuals may experience a dominant parasympathetic response, leading to feelings of numbness, dissociation, and depression. One of the most profound discoveries was the concept of neuroplasticity, the brain's ability to reorganize itself by forming new neural connections throughout life. This plasticity offers hope for recovery, as therapeutic interventions can help rewire the brain and restore more balanced functioning. Techniques such as mindfulness, yoga, and neurofeedback have shown promise in helping trauma survivors regulate their nervous systems and regain a sense of control. Mindfulness practices, for instance, have been found to enhance the functioning of the prefrontal cortex, improving emotional regulation and reducing the amygdala's hyperactivity. Yoga and other body-based therapies can help reconnect individuals with their bodies, countering the disconnection often caused by trauma. Neurofeedback, which involves training individuals to alter their brainwave patterns, can help restore normal brain function and alleviate symptoms of PTSD. These advances in neuroscience have also underscored the importance of a holistic approach to trauma treatment. Effective therapy must address not only the psychological aspects of trauma, but also the physiological changes it induces. This integrated perspective is essential for helping individuals heal and reclaim their lives. Understanding the brain's response to trauma has profound implications for both treatment and prevention. By recognizing the signs of trauma and intervening early, we can mitigate its long-term effects and promote resilience. Furthermore, public awareness of the impact of trauma can lead to more supportive environments that foster healing and recovery. In conclusion, the neuroscience revolution has transformed our understanding of trauma, revealing how deeply it affects the brain and body. These insights have paved the way for innovative treatments that harness the brain's natural capacity for healing, offering hope to millions of trauma survivors worldwide. By continuing to explore the brain's mysteries, we can develop even more effective strategies to help individuals overcome the shadows of their past and build brighter futures. Running for your life, the anatomy of survival. Understanding how the brain and body respond to trauma requires examining the intricate systems that govern survival. This chapter delves into the anatomy of survival, exploring how our bodies are hardwired to react to threats and the profound impact of these responses on trauma survivors. The human body is equipped with an elaborate survival mechanism that has evolved over millennia. At the core of this system is the autonomic nervous system, ANS, which regulates involuntary bodily functions and consists of two main branches, the sympathetic and parasympathetic nervous systems. The sympathetic nervous system, SNS, prepares the body for action, triggering the fight or flight response when faced with danger. This response involves a cascade of physiological changes, including increased heart rate, rapid breathing, and the release of stress hormones like adrenaline and cortisol. In contrast, the parasympathetic nervous system, PNS, promotes relaxation and recovery, counterbalancing the SNS by slowing the heart rate and promoting digestion and healing. Ideally, these two systems work in harmony, allowing us to respond to threats and then return to a state of calm. However, in trauma survivors, this balance is often disrupted, leading to chronic activation of the SNS and an impaired ability to engage the PNS. When faced with a traumatic event, the brain's amygdala signals the hypothalamus to activate the SNS, resulting in the immediate mobilization of the body's resources for survival. This response is essential for escaping life-threatening situations, but can become maladaptive when the threat is prolonged or inescapable. Trauma survivors often remain in a state of heightened arousal long after the danger has passed, leading to symptoms such as hypervigilance, anxiety, and insomnia. The body's response to trauma is not limited to the SNS. The dorsal vagal complex, DVC, part of the parasympathetic nervous system, can also play a crucial role. When escape is impossible, the DVC triggers a freeze response characterized by immobilization and dissociation. This response is a last-ditch effort to survive by feigning death, a strategy observed in many animals. While it can be life-saving in the moment, prolonged activation of the DVC can lead to feelings of numbness, detachment, and emotional shutdown in trauma survivors. The interplay between the SNS and DVC responses illustrates the complexity of the body's reaction to trauma. These responses are mediated by various brain structures, including the amygdala, hippocampus, and prefrontal cortex. The amygdala, responsible for detecting threats, can become hyperactive in trauma survivors, leading to exaggerated fear responses. The hippocampus, involved in memory formation, may shrink due to chronic stress, impairing the ability to integrate and contextualize traumatic memories. The prefrontal cortex, which regulates emotions and impulses, often shows reduced activity, compromising the ability to manage fear and stress. This altered brain functioning can result in a range of symptoms, from flashbacks and intrusive memories to emotional numbing and difficulty concentrating. These symptoms reflect the body's ongoing struggle to process and cope with the trauma, as the brain remains in a state of alert, constantly scanning for potential threats. The concept of neuroplasticity offers hope for recovery. Neuroplasticity refers to the brain's ability to reorganize itself by forming new neural connections. Therapeutic interventions can leverage this capacity to help trauma survivors rewire their brains and restore a sense of safety and control. Techniques such as mindfulness, yoga, and neurofeedback can facilitate this process by promoting relaxation and enhancing emotional regulation. Mindfulness practices, for example, can help calm the hyperactive amygdala and strengthen the prefrontal cortex, improving the ability to manage stress and emotions. Yoga and other body-based therapies can help reconnect individuals with their bodies, counteracting the dissociation often caused by trauma. Neurofeedback, which involves training individuals to alter their brainwave patterns, can help normalize brain function and alleviate symptoms of PTSD. Understanding the body's response to trauma also underscores the importance of early intervention and prevention. By recognizing the signs of trauma and providing timely support, we can mitigate its long-term effects and promote resilience. Public awareness of the impact of trauma can lead to more compassionate and supportive environments that foster healing and recovery. In conclusion, the anatomy of survival reveals how deeply trauma affects the brain and body. These insights highlight the importance of a holistic approach to trauma treatment that addresses both the physiological and psychological dimensions of recovery. By harnessing the brain's natural capacity for healing, we can help trauma survivors reclaim their lives and build brighter futures. This integrated perspective is essential for addressing the profound and lasting effects of trauma on human well-being. Body-brain connections. The pathway of trauma. Trauma deeply affects the connections between the body and the brain, influencing how individuals experience and respond to stress. This chapter explores the intricate relationship between physical sensations and emotional experiences, revealing how trauma disrupts these connections and impacts overall well-being. The body and brain are in constant communication through the nervous system. Sensory information from the body travels to the brain, where it is processed and interpreted, influencing thoughts, emotions, and behaviors. This bidirectional communication is essential for maintaining homeostasis and responding effectively to environmental challenges. Trauma disrupts this communication, leading to a state of disconnection between the body and the brain. Trauma survivors often experience a heightened state of arousal, where the body remains in a constant state of alert, ready to respond to perceived threats. This persistent activation of the body's stress response can result in chronic tension, hypervigilance, and anxiety. The brain's ability to interpret sensory information is also compromised by trauma. The prefrontal cortex, responsible for rational thinking and decision-making, often shows reduced activity, impairing the ability to regulate emotions and impulses. Meanwhile, the amygdala, which detects threats, becomes hyperactive, leading to exaggerated fear responses. This imbalance between the prefrontal cortex and the amygdala contributes to the emotional instability seen in trauma survivors. The body holds memories of traumatic experiences, which can manifest as physical symptoms. These somatic memories are stored in the muscles, tissues, and nervous system, leading to sensations such as pain, tightness, or numbness. Trauma survivors may experience these physical symptoms without being consciously aware of their connection to past traumatic events. Understanding the body-brain connection is crucial for effective trauma treatment. Therapies that integrate the body and mind can help restore this connection and promote healing. Techniques such as yoga, mindfulness, and body-based therapies focus on reconnecting individuals with their bodies, helping them become more aware of their physical sensations and how they relate to emotional experiences. Yoga, for instance, encourages mindful movement and breathing, which can help calm the nervous system and reduce hyperarousal. Mindfulness practices cultivate present moment awareness, enabling individuals to observe their thoughts and feelings without becoming overwhelmed by them. Body-based therapies, such as somatic experiencing, focus on releasing stored tension and trauma from the body, allowing individuals to process and integrate their experiences. Neurofeedback is another promising approach that helps regulate the brain's activity by training individuals to alter their brainwave patterns. This technique can help normalize the functioning of the prefrontal cortex and the amygdala, improving emotional regulation and reducing symptoms of PTSD. The vagus nerve, a key component of the parasympathetic nervous system, plays a crucial role in the body-brain connection. It regulates heart rate, digestion, and other vital functions, promoting relaxation and recovery. Activating the vagus nerve through practices such as deep breathing, chanting, or cold exposure can help shift the body from a state of stress to one of calm and balance. Trauma-informed therapy recognizes the importance of addressing both the physical and psychological aspects of trauma. This holistic approach considers the individual's entire experience, including their bodily sensations, emotions, and thoughts. By integrating body-based interventions with traditional talk therapy, therapists can help clients process trauma more effectively and achieve greater overall well-being. In conclusion, the body-brain connection is a fundamental aspect of trauma and its treatment. Trauma disrupts this connection, leading to a range of physical and emotional symptoms. Effective treatment requires restoring the communication between the body and the brain, helping individuals become more aware of their physical sensations and how they relate to their emotions. By integrating body-based therapies with traditional approaches, we can provide a more comprehensive and effective path to healing for trauma survivors. This holistic perspective is essential for addressing the complex and lasting impact of trauma on human health and well-being. Losing your body, losing yourself. Trauma has a profound impact on how individuals perceive and relate to their bodies. This chapter delves into the concept of losing one's sense of physical self, a common experience among trauma survivors, and examines the ways in which trauma disrupts the mind-body connection, leading to a disconnection from one's own body. One of the most devastating effects of trauma is the sense of disembodiment it can cause. Trauma survivors often report feeling detached from their bodies, as if they are merely observing themselves from the outside. This phenomenon, known as dissociation, serves as a coping mechanism to help individuals survive overwhelming experiences. However, while dissociation can protect the mind from the full impact of trauma, it also creates a deep rift between the body and the self. The body's natural responses to trauma, fight, flight, or freeze, are governed by the autonomic nervous system. In the face of extreme danger, the body may enter a state of hyperarousal, where the sympathetic nervous system dominates, leading to heightened alertness and readiness for action. Alternatively, if escape is impossible, the body may switch to a state of hypoarousal, characterized by numbness and immobility, mediated by the parasympathetic nervous system. These survival mechanisms are essential for immediate safety, but can become chronic in trauma survivors, leading to ongoing physical and emotional symptoms. The impact of trauma on the body is not only psychological, but also physiological. Chronic stress and hyperarousal can result in a host of physical health problems, including heart disease, digestive issues, and chronic pain. Trauma survivors often experience a range of somatic symptoms, such as headaches, muscle tension, and fatigue, which are manifestations of the body's attempts to process and store traumatic memories. Reconnecting with the body is a crucial step in the healing process for trauma survivors. This involves becoming aware of bodily sensations and learning to interpret them in the context of current rather than past experiences. Mindfulness practices, such as body scanning and deep breathing, can help individuals tune into their physical sensations and develop a greater sense of presence in their bodies. Yoga and other body-centered therapies play a significant role in restoring the mind-body connection. These practices emphasize gentle movement, breath control, and mindful awareness, helping individuals to feel safe and grounded in their bodies. By engaging in these practices, trauma survivors can begin to release the tension and trauma stored in their muscles and tissues, fostering a sense of physical and emotional integration. Another critical aspect of healing from trauma is understanding the role of the vagus nerve in regulating the body's stress response. The vagus nerve is a key component of the parasympathetic nervous system, influencing heart rate, digestion, and other autonomic functions. Stimulating the vagus nerve through practices such as deep breathing, singing, and cold exposure can help shift the body from a state of hyperarousal to one of calm and relaxation. Therapists working with trauma survivors must recognize the importance of addressing both the physical and psychological aspects of trauma. This holistic approach involves creating a safe and supportive environment where individuals can explore their bodily sensations and emotional experiences without fear of re-traumatization. Techniques such as grounding exercises, sensory awareness, and movement therapy can help individuals reconnect with their bodies and reclaim a sense of physical self. In addition to body-centered therapies, traditional talk therapy remains an essential component of trauma treatment. However, for many trauma survivors, verbalizing their experiences can be challenging. Combining talk therapy with body-based approaches allows for a more comprehensive and effective treatment plan, addressing the full spectrum of trauma's impact on the mind and body. In conclusion, trauma profoundly affects the connection between the mind and body, often leading to a sense of disembodiment and physical disconnection. Healing from trauma requires reestablishing this connection through mindful awareness, body-centered therapies, and a holistic approach to treatment. By integrating these practices, trauma survivors can begin to feel safe and present in their bodies, paving the way for a deeper sense of self and well-being. This comprehensive approach is essential for addressing the complex and lasting effects of trauma on both the mind and body. Getting on the same wavelength. Attachment and attunement. Understanding trauma requires delving into how early relationships shape the brain and influence the ability to form healthy connections throughout life. This chapter focuses on the concepts of attachment and attunement, exploring how these foundational aspects of development are disrupted by trauma and how they can be healed. Attachment theory, developed by John Bowlby, posits that early interactions with caregivers form the blueprint for future relationships. Secure attachment occurs when caregivers are consistently responsive to a child's needs, providing a sense of safety and reliability. This secure base allows the child to explore the world with confidence, knowing they can return to a caregiver for comfort and support. Conversely, inconsistent or neglectful caregiving can lead to insecure attachment, characterized by anxiety, fear, and a lack of trust. Trauma, particularly in childhood, can severely disrupt the development of secure attachment. Children who experience abuse, neglect, or the loss of a caregiver often struggle with forming healthy relationships later in life. They may develop attachment styles that are avoidant, anxious, or disorganized, each presenting unique challenges. Avoidant individuals tend to withdraw and avoid closeness, while anxious individuals may be clingy and overly dependent. Those with a disorganized attachment style display a mix of these behaviors, often due to having experienced fear without a clear source of comfort. Attunement, the ability of a caregiver to be in tune with a child's emotional and physical states, is crucial for healthy development. When caregivers are attuned, they can respond appropriately to a child's needs, fostering emotional regulation and resilience. Trauma can disrupt this process, as caregivers who are themselves traumatized or overwhelmed may struggle to provide the necessary attunement. This lack of attunement can leave children feeling misunderstood and unsupported, exacerbating feelings of isolation and distress. Healing from trauma involves reestablishing secure attachment and fostering attunement. This process often begins in therapeutic settings, where therapists provide a safe and responsive environment that mimics the attunement of a healthy caregiver. Through consistent and empathetic interactions, therapists can help clients develop a sense of security and trust, essential components of healing. One effective therapeutic approach is the use of mindfulness and body awareness techniques. These practices help individuals become more attuned to their own internal states, promoting self-regulation and emotional resilience. By learning to recognize and respond to their own needs, trauma survivors can begin to repair the disrupted pathways of attachment and attunement. Neurofeedback is another promising tool in trauma therapy. This technique involves training individuals to alter their brainwave patterns, helping to stabilize mood and enhance emotional regulation. Neurofeedback can support the development of secure attachment by promoting a balanced and calm state of mind, making it easier for individuals to form and maintain healthy relationships. The role of the vagus nerve in emotional regulation and social engagement is also critical. The vagus nerve, which plays a key role in the parasympathetic nervous system, helps regulate heart rate, digestion, and other bodily functions. Practices that stimulate the vagus nerve, such as deep breathing and chanting, can promote a state of calm and enhance the capacity for social connection. Therapeutic interventions that focus on the body are particularly valuable for trauma survivors. Yoga, dance, and other forms of movement therapy can help individuals reconnect with their bodies and experience a sense of safety and presence. These practices encourage the release of tension and trauma stored in the body, facilitating emotional and physical healing. Creating supportive social environments is also crucial for healing. Trauma survivors benefit from relationships that are consistent, empathetic, and attuned to their needs. Community-based programs, support groups, and social networks can provide the necessary support and connection, helping individuals to rebuild their sense of trust and belonging. In conclusion, trauma profoundly affects the development of attachment and attunement, disrupting the ability to form healthy relationships. Healing involves reestablishing these foundational aspects through therapeutic interventions that foster safety, empathy, and connection. By integrating mindfulness, neurofeedback, body-based therapies, and supportive social environments, trauma survivors can rebuild their capacity for secure attachment and emotional regulation. This comprehensive approach is essential for addressing the deep and lasting impact of trauma on relational and emotional well-being. Trapped in relationships, the cost of abuse and neglect. Trauma profoundly influences how individuals relate to others, especially when it stems from abuse and neglect in childhood. This chapter examines the complex dynamics of relationships impacted by trauma and explores the long-term effects on emotional and psychological well-being. Children who grow up in abusive or neglectful environments often develop a deep-seated fear of intimacy and trust. These early experiences shape their perception of relationships, making it difficult to form healthy connections later in life. Abuse teaches children that the world is dangerous and unpredictable, while neglect leaves them feeling invisible and unworthy of care. Both experiences undermine the fundamental sense of safety and security that is essential for healthy development. Abusive relationships are characterized by a cycle of violence and control. The abuser exerts power over the victim, creating an environment of fear and dependence. Victims of abuse often feel trapped, believing they have no escape from their situation. This sense of entrapment can lead to a range of psychological issues, including anxiety, depression, and post-traumatic stress disorder, PTSD. Over time, the constant exposure to fear and threat alters the brain's stress response, making it difficult to regulate emotions and responses. Neglect, though less overtly violent, is equally damaging. Children who are neglected often feel abandoned and unimportant. Without consistent and nurturing care, they struggle to develop a sense of self-worth and belonging. Neglect disrupts the development of the brain's reward system, making it harder for individuals to experience pleasure and motivation. This can result in a pervasive sense of emptiness and disconnection. The impact of abuse and neglect extends into adulthood, affecting relationships with partners, friends, and even their own children. Survivors of trauma may find it challenging to establish boundaries, trust others, and maintain stable relationships. They might oscillate between extremes of emotional closeness and distance, mirroring the unpredictability of their early experiences. This pattern often leads to repeated cycles of dysfunctional relationships, perpetuating the trauma. Healing from the effects of abuse and neglect involves rebuilding the capacity for healthy relationships. Therapy plays a crucial role in this process, providing a safe space for individuals to explore and understand their experiences. Therapists help clients identify and challenge the distorted beliefs about themselves and others that have developed as a result of trauma. By fostering a therapeutic relationship based on trust and empathy, therapists can model healthy interactions and support clients in developing new relational patterns. Body-based therapies, such as yoga and somatic experiencing, are particularly effective in addressing the physical manifestations of trauma. These approaches help individuals reconnect with their bodies, release stored tension, and develop a sense of safety and presence. By learning to listen to and trust their bodily sensations, trauma survivors can begin to rebuild the mind-body connection that was disrupted by abuse and neglect. Mindfulness practices are also valuable in healing relational trauma. Mindfulness encourages individuals to observe their thoughts and feelings without judgment, fostering greater self-awareness and emotional regulation. This heightened awareness can help trauma survivors recognize and interrupt harmful relational patterns, allowing them to make more conscious and healthy choices in their interactions. Supportive social networks are essential for recovery. Relationships with empathetic and understanding individuals can provide the validation and support needed to heal from trauma. Community-based programs, support groups, and peer mentoring can offer a sense of belonging and reduce feelings of isolation. Reparenting, a therapeutic approach where individuals learn to care for themselves as a nurturing parent would, can also be beneficial. This process involves developing self-compassion, setting healthy boundaries, and creating a sense of safety and stability. Reparenting helps individuals internalize a positive and supportive self-image, counteracting the negative messages received in childhood. Addressing the intergenerational transmission of trauma is crucial. Children of trauma survivors are at risk of inheriting the unresolved emotional and relational issues of their parents. Breaking this cycle involves providing trauma-informed care and education to parents, helping them develop healthier ways of relating to their children. In conclusion, the long-term effects of abuse and neglect profoundly impact relationships and emotional well-being. Healing requires a multifaceted approach that addresses both the psychological and physical dimensions of trauma. Through therapy, body-based practices, mindfulness, and supportive social networks, trauma survivors can rebuild their capacity for healthy relationships and reclaim a sense of safety and self-worth. This comprehensive approach is essential for breaking the cycle of trauma and fostering lasting recovery and resilience. What's love got to do with it? The vital role of attachment. Attachment is the cornerstone of healthy emotional and psychological development. This chapter explores the fundamental importance of love and secure relationships in shaping our ability to cope with stress and trauma, and how disruptions in attachment can lead to profound and lasting effects. From birth, humans are wired for connection. The attachment bond between an infant and their primary caregiver is critical for survival and development. This bond provides the child with a sense of safety and security, enabling them to explore the world and develop trust. When caregivers are responsive and attuned to their child's needs, they foster a secure attachment. This foundational relationship sets the stage for future emotional and social functioning. Secure attachment leads to resilience, allowing individuals to navigate life's challenges with confidence. Children with secure attachments tend to be more adaptable, empathetic, and capable of forming healthy relationships. They learn to regulate their emotions effectively, knowing they can rely on their caregivers for support. This security is internalized, becoming a part of their personality and guiding their interactions with others. However, when attachment is disrupted, the consequences can be severe. Inconsistent, neglectful, or abusive caregiving can lead to insecure attachment styles, which manifest as anxiety, avoidance, or disorganization in relationships. Children who experience such disruptions may struggle with emotional regulation, self-esteem, and trust throughout their lives. These early attachment wounds can predispose individuals to mental health issues, including depression, anxiety, and post-traumatic stress disorder, PTSD. Trauma further complicates attachment. Traumatic experiences, especially those involving caregivers, can shatter a child's sense of safety and trust. For example, children who witness or experience domestic violence may develop a heightened sensitivity to threat and a constant state of hypervigilance. This state of chronic stress impacts brain development, particularly the areas involved in emotion regulation and impulse control. Healing attachment wounds requires rebuilding a sense of safety and trust. Therapy can play a crucial role in this process, providing a secure and empathetic environment where individuals can explore their attachment patterns and develop healthier relationships. Therapists often serve as attachment figures, offering consistent and responsive care that helps clients rewire their attachment systems. Mindfulness and body-based therapies are effective in addressing the physical and emotional impacts of disrupted attachment. Mindfulness practices help individuals become more aware of their emotional states and bodily sensations, promoting self-regulation and resilience. Body-based therapies, such as yoga and somatic experiencing, can help release tension stored in the body and foster a sense of grounding and presence. The concept of reparenting, where individuals learn to care for themselves in a nurturing and compassionate way, is also essential in healing attachment wounds. Reparenting involves developing self-compassion, setting boundaries, and creating routines that promote stability and well-being. This process helps individuals internalize a sense of safety and support, counteracting the negative effects of early attachment disruptions. Supportive relationships and social networks are vital for recovery. Connections with empathetic and understanding individuals can provide the validation and support needed to heal from attachment wounds. Community-based programs, support groups, and peer mentoring can offer a sense of belonging and reduce feelings of isolation. For parents, understanding the importance of attachment can help break the cycle of trauma. Trauma-informed parenting involves recognizing the signs of attachment disruptions and providing consistent, responsive care. Educating parents about the impact of their behavior on their children's development can promote healthier attachment patterns and prevent the intergenerational transmission of trauma. In conclusion, attachment is fundamental to emotional and psychological well-being. Secure attachment fosters resilience and healthy relationships, while disruptions can lead to long-term challenges. Healing requires a holistic approach that addresses both the emotional and physical impacts of attachment disruptions. Through therapy, mindfulness, body-based practices, and supportive relationships, individuals can rebuild their capacity for secure attachment and develop a stronger sense of self and well-being. This comprehensive approach is essential for fostering lasting recovery and resilience in the face of trauma. Developmental trauma, the hidden epidemic. Developmental trauma, often referred to as the hidden epidemic, has far-reaching effects on individuals' lives, influencing their emotional, psychological, and physical well-being. This chapter delves into the pervasive impact of early traumatic experiences and the challenges they present for treatment and recovery. Developmental trauma occurs when children are exposed to chronic stress or traumatic events, such as abuse, neglect, or exposure to domestic violence during critical periods of brain development. These adverse childhood experiences, ACEs, disrupt the normal development of the brain's architecture, leading to long-term alterations in brain function and structure. The resulting changes affect how individuals perceive the world, regulate their emotions, and interact with others. Children exposed to developmental trauma often display a range of behavioral and emotional problems. They may struggle with impulsivity, aggression, and difficulty concentrating, which can lead to challenges in school and social settings. These children are also at higher risk for developing mental health disorders, including anxiety, depression, and post-traumatic stress disorder, PTSD. The chronic stress of developmental trauma affects the body's stress response systems, leading to an increased risk of physical health problems, such as heart disease, diabetes, and autoimmune disorders. The concept of developmental trauma highlights the importance of the timing and duration of traumatic experiences. Unlike single-event trauma, which can be devastating in its own right, developmental trauma occurs over prolonged periods, compounding its effects. This ongoing exposure to stress alters the brain's wiring, particularly in areas involved in emotion regulation, memory, and executive functioning. One of the most significant impacts of developmental trauma is on the brain's fear processing systems. The amygdala, responsible for detecting threats, becomes hypersensitive, leading to heightened anxiety and hypervigilance. The prefrontal cortex, which helps regulate emotional responses and make rational decisions, often shows reduced activity, making it difficult for individuals to manage their emotions and impulses effectively. The hippocampus, critical for memory and learning, can also be affected, leading to difficulties in forming coherent narratives of their experiences. Attachment theory provides a framework for understanding the relational aspects of developmental trauma. Secure attachment, formed through consistent and nurturing interactions with caregivers, is crucial for healthy emotional and psychological development. However, developmental trauma often disrupts the formation of secure attachment, leading to insecure attachment styles. These styles, such as avoidant, anxious, or disorganized attachment, impact how individuals relate to others and manage their emotional needs. Healing from developmental trauma requires a multifaceted approach that addresses both the psychological and physiological aspects of trauma. Traditional talk therapy, while essential, may not be sufficient on its own. Integrating body-based therapies such as yoga, mindfulness, and somatic experiencing can help individuals reconnect with their bodies and release stored tension and trauma. Mindfulness practices are particularly effective in promoting self-awareness and emotional regulation. By learning to observe their thoughts and feelings without judgment, individuals can develop a greater sense of control over their emotional states. Yoga and other body-based therapies help release physical tension and trauma stored in the body, fostering a sense of grounding and presence. Creating supportive and stable environments is crucial for healing. Trauma-informed care, which emphasizes safety, trustworthiness, and empowerment, can help individuals feel secure and supported as they navigate the healing process. Building strong, supportive relationships with empathetic and understanding individuals is also essential for recovery. These connections provide the validation and encouragement needed to foster resilience and growth. Educating caregivers and professionals about the impact of developmental trauma is vital for preventing its effects and promoting healing. Understanding the signs and symptoms of developmental trauma can help caregivers respond more effectively to children's needs, creating environments that support healthy development and recovery. In conclusion, developmental trauma is a pervasive and often hidden epidemic with profound effects on individuals' emotional, psychological, and physical well-being. Healing requires a comprehensive approach that addresses the complex interplay between brain development, emotional regulation, and relational dynamics. By integrating traditional therapy with body-based practices and creating supportive environments, individuals can begin to recover from the deep and lasting impacts of developmental trauma. This holistic approach is essential for fostering resilience and promoting long-term healing and well-being. Uncovering secrets, the problem of traumatic memory. Traumatic memories differ significantly from ordinary memories in their persistence, vividness, and the intense emotions they evoke. This chapter explores the complexities of traumatic memory, how it affects individuals, and the challenges it presents in the therapeutic process. Unlike typical memories that gradually fade and integrate into the fabric of our past, traumatic memories remain strikingly vivid and fragmented. They often intrude into the present, triggered by reminders that bring back the emotions, sensations, and images of the original trauma. These flashbacks can be so overwhelming that they make it difficult for survivors to distinguish between past and present, causing them to react to current situations as if the trauma were happening all over again. Traumatic memories are stored differently in the brain than ordinary memories. While normal memories are processed and organized by the prefrontal cortex, traumatic memories are often stored in the amygdala, the brain's emotional center. This makes them more likely to be recalled in response to emotional triggers rather than through conscious, deliberate recollection. The amygdala's role in storing these memories explains why they are often accompanied by intense emotional and physical reactions. The hippocampus, which is responsible for organizing and integrating memories, can also be affected by trauma. Chronic stress and high levels of cortisol, a stress hormone, can impair the hippocampus's ability to function effectively. This results in fragmented and disjointed memories that are difficult to piece together into a coherent narrative. Survivors may remember specific details of the trauma vividly, but struggle to place them in a broader context. The persistent and intrusive nature of traumatic memories can lead to various coping mechanisms. Some individuals may try to avoid reminders of the trauma, leading to behaviors such as substance abuse, self-harm, or social withdrawal. Others may become hypervigilant, constantly on guard for potential threats, even in safe environments. These coping strategies, while initially protective, can become maladaptive and interfere with daily life. Therapy aims to help individuals process and integrate their traumatic memories. One of the key challenges in therapy is to create a safe environment where survivors can explore their memories without becoming overwhelmed. This involves carefully pacing the therapeutic process and using techniques that help regulate the emotional intensity of the memories. One effective approach is eye movement desensitization and reprocessing, EMDR, which involves recalling traumatic memories while simultaneously focusing on an external stimulus, such as a moving light or sound. This dual focus helps reduce the emotional charge of the memories, making them less intrusive and easier to integrate. EMDR has been shown to be particularly effective in treating post-traumatic stress disorder, PTSD, and other trauma-related conditions. Another approach is trauma-focused cognitive behavioral therapy, TFCBT, which combines cognitive restructuring with exposure techniques. TFCBT helps individuals challenge and change distorted beliefs related to the trauma while gradually exposing them to memories and reminders of the trauma in a controlled and safe manner. This helps desensitize them to the trauma and reduces avoidance behaviors. Somatic therapies, which focus on the body's responses to trauma, are also valuable in processing traumatic memories. Techniques such as somatic experiencing and sensory motor psychotherapy help individuals become aware of and release physical tension associated with trauma. By working with the body's sensations, these therapies can help integrate traumatic memories and reduce their emotional intensity. Mindfulness practices, which promote present moment awareness, can help individuals manage the distressing emotions and sensations associated with traumatic memories. By cultivating a non-judgmental attitude toward their experiences, survivors can learn to observe their memories and emotions without becoming overwhelmed. This increased awareness and acceptance can facilitate the integration of traumatic memories into a coherent narrative. Supportive relationships and a strong social network are crucial for healing from trauma. Connecting with others who understand and validate one's experiences can provide a sense of safety and support. Group therapy, peer support groups, and community-based programs can offer valuable opportunities for connection and shared healing. In conclusion, traumatic memories pose significant challenges due to their vividness, persistence, and emotional intensity. Effective therapy involves creating a safe and supportive environment, using techniques that help regulate emotional responses, and integrating body-based and mindfulness practices. By addressing the unique nature of traumatic memories, therapy can help survivors reclaim their lives and move toward healing and recovery. This comprehensive approach is essential for addressing the complex and lasting effects of trauma on memory and emotional well-being. The unbearable heaviness of remembering. Traumatic memories are not just haunting. They can also be disorganizing and disruptive, severely impacting an individual's ability to lead a functional life. This chapter delves into the nature of these memories, why they are so persistent, and how they influence behavior and well-being. Traumatic memories differ from regular memories in their intensity and the way they are stored in the brain. Typically, memories are processed and integrated into a coherent narrative by the brain's hippocampus and then stored in the cortex. However, traumatic memories are often stored in fragmented forms in the amygdala, the brain's center for emotions, particularly fear. This means they can be easily triggered by sensory experiences similar to those present during the trauma, leading to flashbacks and intense emotional reactions. These fragmented memories do not fade over time like normal memories. Instead, they remain vivid and intrusive, often surfacing unexpectedly and causing significant distress. The persistence of these memories is linked to the high levels of stress hormones released during the trauma, which affect the brain's ability to process and integrate the experience. This results in the traumatic event remaining alive in the individual's mind, as if it were still happening. The emotional impact of these memories is profound. Survivors may experience overwhelming feelings of fear, shame, and helplessness whenever these memories are triggered. These intense emotions can lead to avoidance behaviors, where individuals go to great lengths to avoid anything that might remind them of the trauma. While avoidance can provide temporary relief, it often exacerbates the problem in the long run by preventing the individual from processing and integrating the traumatic experience. Moreover, the disorganization of traumatic memories can lead to difficulties in distinguishing past from present. Survivors may react to current situations as if they were still in danger, which can lead to inappropriate or exaggerated responses. This can strain relationships and make daily functioning challenging. One of the significant challenges in treating trauma is helping individuals to process these memories in a way that diminishes their power. Traditional talk therapy alone may not be sufficient, as discussing the trauma can sometimes re-traumatize the individual by bringing up the intense emotions associated with the memories. Therefore, treatment often involves a combination of approaches designed to help individuals safely process their trauma. Eye movement desensitization and reprocessing, EMDR, is one such approach. It involves the individual recalling traumatic memories while simultaneously focusing on an external stimulus, such as the therapist's moving finger. This dual focus helps to reduce the emotional intensity of the memories, making them easier to process and integrate. Trauma-focused cognitive behavioral therapy, TFCBT, combines cognitive restructuring with exposure techniques to help individuals face their memories in a controlled and safe environment. This helps to diminish the power of the traumatic memories and reduces avoidance behaviors. Body-based therapies, such as somatic experiencing and sensorimotor psychotherapy, focus on the physical sensations associated with trauma. These therapies help individuals release the tension and stress stored in their bodies, which can alleviate some of the emotional intensity of their memories. Mindfulness practices are also beneficial. They teach individuals to observe their thoughts and feelings without judgment, which can help them manage the distressing emotions and sensations associated with traumatic memories. By staying present and grounded, survivors can learn to respond to their memories with greater calm and control. Supportive relationships and social networks play a critical role in recovery. Connecting with others who understand and validate their experiences can provide a sense of safety and support. Group therapy, peer support groups, and community-based programs offer valuable opportunities for connection and shared healing. In conclusion, traumatic memories are persistent and disruptive due to their intense emotional content and the way they are stored in the brain. Effective therapy involves creating a safe and supportive environment, using techniques that help regulate emotional responses, and integrating body-based and mindfulness practices. By addressing the unique nature of traumatic memories, therapy can help survivors reclaim their lives and move toward healing and recovery. This comprehensive approach is essential for addressing the complex and lasting effects of trauma on memory and emotional well-being. Healing from trauma, owning yourself. Healing from trauma involves reclaiming a sense of ownership over one's life and self. This chapter explores the various pathways to recovery, emphasizing the importance of self-empowerment and the integration of mind and body in the healing process. Trauma often leaves individuals feeling fragmented and disconnected from their sense of self. The journey to recovery begins with the recognition of this disconnection and the commitment to reclaiming a cohesive and empowered identity. This involves addressing the profound impact trauma has on the body, mind, and relationships. A critical aspect of healing is the development of self-awareness and self-regulation. Trauma survivors frequently struggle with intense emotions and physical reactions that seem to arise out of nowhere. Learning to recognize and understand these responses is the first step toward regaining control. Mindfulness practices, such as meditation and deep breathing, can help individuals become more aware of their internal states and develop the ability to regulate their emotions. Another vital component of recovery is the integration of traumatic memories. As previously discussed, traumatic memories are often stored in fragmented and disjointed forms. Therapeutic approaches like eye movement desensitization and reprocessing, EMDR, and trauma-focused cognitive behavioral therapy, TFCBT, can help individuals process these memories and integrate them into a coherent narrative. This integration reduces the emotional intensity of the memories and diminishes their disruptive impact on daily life. Body-based therapies play a significant role in the healing process. Trauma is not only stored in the mind, but also in the body. Practices such as yoga, somatic experiencing, and sensory-motor psychotherapy focus on releasing the physical tension and stress that are often held in the body. These therapies help individuals reconnect with their bodies and develop a sense of safety and presence. The role of relationships in healing cannot be overstated. Trauma often disrupts the ability to form and maintain healthy relationships. Supportive and empathetic relationships are essential for recovery, providing validation, safety, and a sense of connection. Group therapy, peer support groups, and community-based programs offer valuable opportunities for individuals to share their experiences and support each other in the healing process. Empowerment is a crucial theme in trauma recovery. Trauma often leaves individuals feeling powerless and out of control. Reclaiming a sense of agency involves making choices that promote well-being and self-care. This might include setting boundaries, pursuing meaningful activities, and developing routines that provide structure and stability. Creative expression can also be a powerful tool for healing. Engaging in activities such as art, music, writing, or dance allows individuals to express emotions that may be difficult to articulate verbally. Creative expression can help process traumatic experiences and foster a sense of self-discovery and empowerment. Therapists play a vital role in guiding individuals through the healing process. A trauma-informed therapist creates a safe and supportive environment where clients can explore their experiences and develop new coping strategies. The therapeutic relationship itself can be a source of healing, providing a model of healthy and empathetic interaction. Education and self-understanding are also important. Learning about the effects of trauma and the body's response to stress can demystify the symptoms and reduce feelings of shame and self-blame. Understanding that trauma responses are normal reactions to abnormal situations can help individuals feel less isolated and more hopeful about their recovery. Ultimately, healing from trauma is a deeply personal journey that involves reclaiming a sense of ownership over one's life and self. It requires a comprehensive approach that addresses the psychological, physical, and relational dimensions of trauma. By integrating therapeutic practices, fostering supportive relationships, and promoting self-empowerment, individuals can move toward a place of healing and wholeness. This journey, though challenging, leads to a richer and more resilient sense of self and a greater capacity for joy and connection. Language, miracle, and tyranny. Language is both a powerful tool for healing and a potential source of distress for trauma survivors. This chapter examines the dual nature of language in the context of trauma, exploring how it can facilitate recovery and, conversely, how it can sometimes exacerbate suffering. Language allows individuals to make sense of their experiences and communicate with others. For trauma survivors, putting their experiences into words can be a crucial step in the healing process. Narrating the trauma helps organize fragmented memories, transforming chaotic and overwhelming sensations into a coherent story. This process can reduce the emotional intensity of traumatic memories and integrate them into the individual's broader life narrative. However, language can also be a source of tyranny. Trauma often involves experiences that are so overwhelming that they defy verbal description. Survivors may struggle to find words that accurately convey their feelings and experiences. This struggle can lead to frustration and a sense of isolation, as they may feel that no one truly understands what they have been through. Furthermore, the act of speaking about trauma can sometimes re-traumatize individuals. Recounting the traumatic event may trigger intense emotions and physical sensations, making it difficult to remain grounded in the present. Survivors may feel overwhelmed by the resurgence of pain and fear, leading them to avoid discussing their experiences altogether. The therapeutic process aims to balance the use of language in a way that facilitates healing without causing additional harm. Effective therapy provides a safe and supportive environment where survivors can gradually explore their memories and emotions. Therapists help clients find the words to describe their experiences, validating their feelings and helping them construct a coherent narrative. Different therapeutic approaches emphasize various aspects of language and expression. Cognitive behavioral therapy, CBT, focuses on identifying and challenging distorted thoughts related to the trauma. By examining these thoughts, individuals can reframe their experiences and develop a more balanced perspective. This cognitive restructuring can alleviate symptoms of anxiety and depression. Narrative therapy explicitly uses the power of storytelling to help individuals make sense of their lives. In this approach, therapists encourage clients to recount their experiences, identify themes, and construct alternative narratives that emphasize resilience and recovery. By reauthoring their stories, survivors can gain a sense of control and agency. Expressive therapies, such as art therapy, music therapy, and writing therapy, offer alternative ways to communicate when words fall short. These modalities allow individuals to express emotions and experiences through creative means, bypassing the limitations of verbal language. Engaging in creative expression can provide relief and a sense of accomplishment, helping to process and integrate traumatic experiences. Mindfulness practices also play a crucial role in the therapeutic use of language. Mindfulness encourages individuals to observe their thoughts and feelings without judgment, fostering a greater awareness of the present moment. This practice can help trauma survivors recognize when they are being overwhelmed by traumatic memories and bring their focus back to the here and now. In addition to individual therapy, group therapy can be particularly beneficial for trauma survivors. Sharing experiences with others who have undergone similar events can reduce feelings of isolation and foster a sense of community. Group members can support each other in finding the words to describe their experiences, offering validation and understanding. Educating trauma survivors about the nature of language and its role in processing trauma is also essential. Understanding that the struggle to find words is a common experience can reduce feelings of frustration and shame. Recognizing that some aspects of trauma may never be fully captured in words can help individuals accept their experiences without feeling the need to force them into a verbal framework. Ultimately, the goal of using language in therapy is to help trauma survivors reclaim their voices and regain a sense of agency. By finding the words to describe their experiences, individuals can begin to make sense of their past, connect with others, and move forward in their healing journey. In conclusion, language is both a miraculous and a challenging tool in the context of trauma. It has the power to heal by helping individuals organize and articulate their experiences, but it can also be a source of distress when words fail to capture the depth of their pain. Therapeutic approaches that balance the use of language with creative expression and mindfulness can help trauma survivors find their voices and reclaim their lives. This balanced approach is essential for fostering recovery and resilience in the face of traumatic experiences. Letting go of the past. EMDR, eye movement desensitization and reprocessing, EMDR, has emerged as a powerful therapeutic tool for helping trauma survivors process and integrate traumatic memories. This chapter delves into the origins, mechanisms, and effectiveness of EMDR in treating trauma-related disorders. EMDR was developed by Francine Shapiro in the late 1980s. The technique involves the patient recalling traumatic memories while simultaneously engaging in bilateral stimulation, typically through guided eye movements, tapping, or auditory tones. This dual attention approach helps reduce the emotional intensity of traumatic memories and facilitates their integration into a more coherent and less distressing narrative. The process of EMDR is structured and involves several phases. The initial phase focuses on history-taking and treatment planning, where the therapist gathers information about the patient's traumatic experiences and current symptoms. This is followed by preparation, where the patient learns coping strategies to manage distressing emotions that may arise during the sessions. The core of EMDR therapy involves the desensitization phase. During this phase, the patient brings to mind the traumatic memory, including the associated emotions and physical sensations. At the same time, they engage in bilateral stimulation, typically following the therapist's moving finger with their eyes. This process helps the brain reprocess the traumatic memory, reducing its emotional charge and allowing it to be stored in a more adaptive way. EMDR is thought to work by facilitating the brain's natural healing processes. The bilateral stimulation may help to access and reprocess the fragmented and disorganized traumatic memories stored in the amygdala. By doing so, it allows these memories to be integrated into the broader context of the individual's life, reducing their power to cause distress. Research has shown that EMDR is effective in treating post-traumatic stress disorder, PTSD, and other trauma-related conditions. Numerous studies have demonstrated that EMDR can lead to significant reductions in PTSD symptoms, often in fewer sessions than traditional talk therapy. This effectiveness has led to its recognition by major health organizations, including the American Psychological Association and the World Health Organization. One of the strengths of EMDR is its ability to address the physical and emotional aspects of trauma simultaneously. Trauma is often stored in the body, manifesting as physical symptoms such as tension, pain, or numbness. By incorporating bilateral stimulation, EMDR helps release this stored tension, facilitating both psychological and physical healing. EMDR also empowers patients by providing them with a sense of control over their healing process. The structured nature of the therapy, combined with the active engagement required during sessions, helps patients feel more involved and invested in their recovery. This sense of agency is particularly important for trauma survivors who often feel powerless and out of control. The success of EMDR has led to its application in a variety of settings and for a range of conditions beyond PTSD. It has been used to treat anxiety, depression, phobias, and even complex trauma resulting from prolonged and repeated exposure to adverse experiences. The versatility of EMDR makes it a valuable tool in the therapist's arsenal. However, EMDR is not without its challenges. Some patients may initially find the process unsettling or experience an increase in distressing emotions as they begin to confront their traumatic memories. This highlights the importance of the preparation phase, where patients learn coping strategies and build a therapeutic alliance with their therapist. A strong therapeutic relationship provides the safety and support needed to navigate the difficult emotions that may arise during EMDR sessions. Despite these challenges, the benefits of EMDR are profound. Patients often report a sense of relief and resolution that allows them to move forward with their lives. By helping individuals reprocess and integrate their traumatic memories, EMDR opens the door to new possibilities for healing and growth. In conclusion, EMDR represents a significant advancement in the treatment of trauma-related disorders. Its ability to reduce the emotional intensity of traumatic memories and facilitate their integration into a coherent narrative offers profound relief for trauma survivors. By combining psychological and physical healing, EMDR helps individuals reclaim their lives and move beyond the shadows of their past. This comprehensive and effective approach is a testament to the ongoing evolution of trauma therapy, providing hope and healing to those who have endured the unimaginable. Learning to inhabit your body. Yoga. Yoga offers a holistic approach to healing trauma, focusing on the connection between mind, body, and breath. This chapter explores how yoga can help trauma survivors regain a sense of control over their bodies and emotions, fostering resilience and well-being. Trauma often disrupts the connection between mind and body. Survivors may feel detached from their physical selves, experiencing their bodies as sources of discomfort or distress. This disconnection can manifest as a range of physical symptoms, such as chronic pain, tension, and digestive issues. Reestablishing this connection is a crucial step in the healing process. Yoga, with its emphasis on mindful movement and breath awareness, provides a powerful tool for reconnecting with the body. The practice encourages individuals to pay attention to their physical sensations, promoting a sense of presence and grounding. By focusing on the breath and the body's movements, yoga helps to calm the nervous system and reduce the hyperarousal often experienced by trauma survivors. The physical postures, or asanas, in yoga help to release tension stored in the muscles and tissues. This release of physical tension can lead to a corresponding release of emotional stress. For trauma survivors, this process can be profoundly healing, as it allows them to experience their bodies in a new, more positive way. The gentle stretching and strengthening exercises promote flexibility and resilience, both physically and emotionally. Breath control, or pranayama, is another essential aspect of yoga that supports trauma recovery. Deep, controlled breathing activates the parasympathetic nervous system, which promotes relaxation and counteracts the stress response. Learning to control the breath can help individuals manage anxiety and panic attacks, providing a practical tool for self-regulation. The meditative aspect of yoga encourages mindfulness and self-awareness. By practicing mindfulness, individuals learn to observe their thoughts and feelings without judgment, fostering a greater sense of acceptance and compassion. This mindful approach can help trauma survivors process their experiences and reduce the power of traumatic memories. Yoga also promotes a sense of community and connection. Participating in a yoga class can provide a supportive environment where individuals feel safe and understood. The sense of belonging and shared experience can be particularly beneficial for trauma survivors who often feel isolated and disconnected. One of the strengths of yoga as a therapeutic tool is its adaptability. Yoga can be tailored to meet the needs of each individual, regardless of their physical abilities or limitations. This flexibility makes it accessible to a wide range of people, including those with physical disabilities or chronic health conditions. The practice can be modified to accommodate different levels of experience and comfort, ensuring that everyone can benefit from its healing properties. Research supports the effectiveness of yoga in reducing symptoms of trauma and promoting overall well-being. Studies have shown that regular yoga practice can lead to significant improvements in mood, anxiety, and PTSD symptoms. These findings highlight the potential of yoga as a complementary treatment for trauma, alongside traditional therapeutic approaches. Integrating yoga into a comprehensive treatment plan can enhance the overall effectiveness of trauma therapy. While traditional talk therapy addresses the psychological aspects of trauma, yoga provides a physical outlet for processing and releasing stress. This combination of mind and body approaches can lead to more holistic healing and recovery. Practitioners should approach yoga with sensitivity and awareness of its potential to trigger trauma responses. It is important to create a safe and supportive environment where individuals feel comfortable exploring their physical and emotional boundaries. Trauma-sensitive yoga instructors are trained to recognize and respond to the needs of trauma survivors, ensuring that the practice remains a positive and empowering experience. In conclusion, yoga offers a valuable tool for healing trauma by promoting the reconnection of mind and body. Through mindful movement, breath control, and meditation, yoga helps individuals regain control over their physical and emotional states. The practice provides a safe and supportive environment for processing and releasing trauma, fostering resilience and well-being. As part of a comprehensive treatment plan, yoga can enhance the overall effectiveness of trauma therapy, offering hope and healing to those who have experienced the profound effects of trauma. Putting the pieces together. Self-leadership. The journey to healing from trauma involves not only therapeutic interventions, but also the cultivation of self-leadership. This chapter focuses on the concept of self-leadership, a framework for understanding and managing the different parts of oneself that emerge from traumatic experiences. Trauma often fragments the self, leading to internal conflicts and a sense of disconnection. Survivors may feel as if different parts of themselves are at odds, each with its own needs and agendas. These parts can include the wounded child, the protector, the critic, and various others that have developed as coping mechanisms. Understanding and integrating these parts is crucial for achieving a sense of wholeness and self-coherence. Self-leadership is based on the Internal Family Systems, IFS, model, developed by Dr. Richard Schwartz. IFS posits that the mind is composed of multiple subpersonalities or parts, each with its own perspective and purpose. In a healthy system, these parts work together harmoniously under the guidance of the self, the core of one's being, characterized by qualities such as calmness, curiosity, compassion, and confidence. Trauma disrupts this harmony, often resulting in some parts becoming extreme or taking over the individual's internal system. For instance, protective parts may become hypervigilant or aggressive, while wounded parts may be stuck in pain and fear. The goal of self-leadership is to restore balance by helping the self take a leadership role, guiding and integrating these parts. The first step in this process is to develop self-awareness and recognize the presence of different parts. Mindfulness practices can be particularly helpful in this regard, allowing individuals to observe their thoughts and emotions without judgment. By identifying and acknowledging their parts, survivors can begin to understand the roles these parts play and the functions they serve. Once the parts are identified, the next step is to build a relationship with them. This involves listening to their concerns, understanding their perspectives, and appreciating their efforts to protect or manage the trauma. Establishing a compassionate dialogue with these parts can reduce internal conflict and foster a sense of safety and trust. Therapists play a critical role in facilitating this process. They guide individuals in exploring their internal landscapes, helping them connect with their parts in a supportive and non-judgmental manner. Through this therapeutic relationship, clients learn to embody the qualities of the self, such as empathy and patience, which are essential for effective self-leadership. As individuals develop a stronger sense of self, they can begin the work of healing and integrating their parts. This involves addressing the needs and concerns of each part, resolving internal conflicts, and finding ways for the parts to work together harmoniously. Techniques such as visualization, role-playing, and creative expression can be used to facilitate this integration. One of the key aspects of self-leadership is learning to manage the inner critic, a part that often becomes particularly harsh and punitive in trauma survivors. The inner critic can perpetuate feelings of shame, guilt, and unworthiness. By approaching the inner critic with curiosity and compassion, individuals can transform its role from a harsh judge to a supportive ally, helping to foster self-acceptance and resilience. Self-leadership also involves setting boundaries and making choices that reflect one's true values and needs. This can be challenging for trauma survivors who may have learned to prioritize others' needs over their own or to avoid conflict at all costs. Developing assertiveness and self-advocacy skills is essential for creating a balanced and fulfilling life. In addition to individual work, self-leadership benefits from the support of a community. Connecting with others who understand and validate one's experiences can provide encouragement and reinforce the qualities of the self. Support groups, peer mentoring, and community-based programs offer valuable opportunities for shared growth and healing. Ultimately, self-leadership is about reclaiming one's life from the grip of trauma. It involves recognizing the strengths and resources within oneself, fostering internal harmony, and making choices that align with one's true self. This journey requires patience, commitment, and a willingness to face and embrace all parts of oneself. In conclusion, self-leadership is a vital component of healing from trauma. By developing self-awareness, building relationships with internal parts, and fostering the qualities of the self, individuals can achieve greater integration and coherence. This process empowers trauma survivors to navigate their healing journey with confidence and resilience, transforming their relationship with themselves and the world around them. Through self-leadership, individuals can move from a state of fragmentation to one of wholeness and empowerment, reclaiming their lives and identities. Filling in the holes. Creating structures. Creating structures in life is a critical aspect of healing from trauma. This chapter explores how establishing routines, setting goals, and developing a supportive environment can help trauma survivors regain a sense of control and stability. Trauma often leaves individuals feeling disoriented and disconnected from their sense of self. Establishing structures can provide the framework needed to rebuild their lives and identities. Structures offer predictability and order, which are essential for creating a sense of safety and security. They help individuals organize their time, manage stress, and set boundaries, enabling them to focus on their recovery. Routines play a significant role in creating structure. Regular daily activities, such as waking up at the same time, exercising, eating meals, and going to bed, can help regulate the body's internal clock and improve overall well-being. Consistent routines provide a sense of normalcy and predictability, reducing anxiety and helping individuals feel more grounded. For trauma survivors, establishing routines can be particularly challenging, but it is also incredibly beneficial. Setting achievable goals is another vital component of creating structures. Goals provide direction and motivation, giving individuals something to strive for. They can be small, immediate goals, like completing a daily task, or larger, long-term goals, such as pursuing education or career aspirations. Setting and achieving goals helps build confidence and a sense of accomplishment, which are crucial for restoring self-esteem. Supportive environments are essential for fostering recovery. Surrounding oneself with empathetic and understanding people can provide the encouragement and validation needed to heal. This includes not only personal relationships, but also professional support from therapists, counselors, and support groups. A positive and nurturing environment can help individuals feel safe to explore their emotions and work through their trauma. Creating a physical space that promotes healing is also important. A clutter-free, organized, and aesthetically pleasing environment can reduce stress and create a sense of calm. Personalizing one's living space with items that bring comfort and joy can enhance feelings of safety and well-being. This might include photographs, artwork, plants, or other objects that hold positive associations. Mindfulness practices can be integrated into daily routines to enhance structure and support healing. Mindfulness involves being present in the moment and fully engaging with one's surroundings and activities. Techniques such as meditation, deep breathing, and mindful movement can help individuals manage stress and stay connected to the present. These practices promote self-awareness and emotional regulation, which are crucial for recovery. Developing healthy coping strategies is another key aspect of creating structures. Trauma survivors often turn to maladaptive behaviors, such as substance abuse or self-harm, to cope with their pain. Identifying and practicing healthy alternatives, such as exercise, creative expression, or spending time in nature, can provide more constructive ways to manage emotions and reduce stress. Therapeutic interventions can support the creation of structures. Cognitive behavioral therapy, CBT, and other evidence-based approaches can help individuals develop skills for setting goals, managing time, and creating routines. Therapists can work with clients to identify barriers to establishing structures and develop strategies to overcome them. Building resilience is a gradual process that involves developing skills and habits that support long-term well-being. This includes learning to adapt to change, developing problem-solving skills, and cultivating a positive mindset. Resilience is not about avoiding difficulties, but about facing challenges with strength and determination. Community involvement can also enhance the creation of structures. Engaging in community activities, volunteering, or participating in group events can provide a sense of purpose and belonging. Being part of a community offers opportunities for social connection, which is essential for emotional support and recovery. In conclusion, creating structures is a fundamental aspect of healing from trauma. By establishing routines, setting goals, and developing supportive environments, individuals can regain a sense of control and stability in their lives. These structures provide the foundation for rebuilding one's identity and fostering long-term recovery. Through mindfulness practices, healthy coping strategies, and community involvement, trauma survivors can create a framework that supports their well-being and resilience. This comprehensive approach to creating structures is essential for overcoming the disorientation and disconnection caused by trauma, enabling individuals to reclaim their lives and move forward with confidence and purpose. Rewiring the brain. Neurofeedback. Neurofeedback is an innovative therapeutic technique that helps trauma survivors rewire their brains, promoting self-regulation and emotional stability. This chapter explores the science behind neurofeedback, its application in trauma therapy, and its benefits for those recovering from trauma. Neurofeedback, also known as EEG biofeedback, involves monitoring and training brainwave activity. During a neurofeedback session, electrodes are placed on the scalp to measure brainwaves, which are then displayed on a computer screen. The therapist guides the patient through exercises that help them learn to modify their brainwave patterns. By providing real-time feedback, neurofeedback helps individuals develop greater control over their brain function. The primary goal of neurofeedback is to enhance the brain's ability to self-regulate. Trauma can disrupt normal brainwave patterns, leading to issues such as hypervigilance, anxiety, and emotional dysregulation. Neurofeedback aims to restore balanced brainwave activity, promoting a state of calm and focused attention. This improved regulation can reduce symptoms of PTSD, anxiety, and depression, common among trauma survivors. The process of neurofeedback is gradual and typically involves multiple sessions. Initially, the therapist conducts a brain map or QEG, quantitative electroencephalography, to identify specific areas of dysregulation. This mapping helps tailor the training to the individual's unique needs. During subsequent sessions, individuals practice altering their brainwave patterns through various mental exercises and visual or auditory cues provided by the computer system. One of the significant advantages of neurofeedback is its non-invasive nature. Unlike medication, which can have side effects and may not address the underlying neurological dysregulation, neurofeedback trains the brain to function more effectively on its own. This makes it a valuable option for individuals who prefer a drug-free approach or who have not found relief through traditional therapies. Neurofeedback is particularly beneficial for trauma survivors because it directly targets the neurological impact of trauma. Chronic stress and trauma can cause the brain to become stuck in patterns of high arousal or hypoarousal, making it difficult for individuals to relax or engage fully in life. By training the brain to shift out of these maladaptive patterns, neurofeedback helps restore a sense of equilibrium. Research supports the efficacy of neurofeedback in treating trauma-related conditions. Studies have shown that neurofeedback can lead to significant improvements in symptoms of PTSD, anxiety, and depression. These benefits are often long-lasting, as neurofeedback fosters enduring changes in brain function. The therapeutic benefits of neurofeedback extend beyond symptom reduction. Many individuals report an enhanced sense of well-being, improved cognitive function, and greater emotional resilience. By improving brain regulation, neurofeedback can enhance overall quality of life, helping individuals feel more capable and confident in managing their emotions and responses. Neurofeedback also complements other therapeutic approaches. When combined with traditional talk therapy, mindfulness practices, or body-based therapies, neurofeedback can enhance the overall effectiveness of treatment. It provides a physiological foundation for psychological and emotional work, making it easier for individuals to engage in and benefit from other therapeutic modalities. The process of neurofeedback is collaborative, requiring active participation from the individual. This engagement fosters a sense of agency and empowerment, which is particularly important for trauma survivors who may feel a loss of control over their lives. By taking an active role in their healing, individuals can build confidence and resilience. Therapists play a crucial role in guiding and supporting individuals through the neurofeedback process. They help interpret the brainwave data, set achievable goals, and provide encouragement and feedback. The therapeutic relationship is enhanced by the collaborative nature of neurofeedback, as it involves working together to achieve measurable improvements in brain function. In conclusion, neurofeedback offers a promising approach to trauma therapy by directly addressing the neurological impact of trauma. Through real-time feedback and training, individuals can learn to regulate their brainwave activity, leading to reduced symptoms and improved emotional stability. Neurofeedback is a non-invasive, drug-free technique that complements other therapeutic approaches, enhancing overall treatment effectiveness. By promoting self-regulation and resilience, neurofeedback helps trauma survivors reclaim control over their lives and move toward healing and recovery. This innovative approach provides a powerful tool for addressing the complex and lasting effects of trauma on the brain and body. Finding your voice, communal rhythms and theater. This chapter explores the powerful role of communal activities, particularly theater and rhythmic movement, in helping trauma survivors reclaim their voice and reconnect with others. These communal practices provide a unique and transformative path to healing, emphasizing the importance of connection, expression, and shared experiences. Trauma often isolates individuals, leaving them feeling disconnected from themselves and others. Reestablishing a sense of community and belonging is crucial for recovery. Communal activities, such as theater and rhythmic movement, offer a supportive environment where individuals can express themselves and connect with others in meaningful ways. These activities help break the isolation that trauma imposes, fostering a sense of unity and shared purpose. Theater provides a unique medium for expression and healing. Participating in theater allows individuals to step into different roles and perspectives, exploring various aspects of their identity and experiences. This process can be particularly therapeutic for trauma survivors who may struggle with feelings of fragmentation and disconnection. By embodying different characters and narratives, they can gain new insights into their own stories and emotions. One of the key therapeutic benefits of theater is its focus on voice and communication. Trauma often silences individuals, leaving them feeling voiceless and powerless. Theater encourages participants to use their voices, express their feelings, and be heard by others. This can be incredibly empowering, helping survivors reclaim their sense of agency and self-expression. The communal nature of theater also fosters empathy and understanding, as participants listen to and support each other's stories. Rhythmic movement, including activities such as dance and drumming, also plays a significant role in trauma recovery. These activities engage the body in rhythmic patterns, which can have a calming and organizing effect on the nervous system. Rhythmic movement helps regulate arousal levels, reducing symptoms of anxiety and hypervigilance that are common in trauma survivors. The repetitive nature of these movements provides a sense of predictability and safety, counteracting the chaos and unpredictability of traumatic experiences. Engaging in rhythmic activities within a group setting enhances their therapeutic impact. Group drumming or dancing creates a shared rhythm that connects participants, fostering a sense of unity and collective energy. This communal rhythm can be deeply soothing and grounding, helping individuals feel more connected to themselves and others. It also provides an outlet for expressing emotions that may be difficult to articulate verbally. The chapter highlights specific programs and initiatives that use theater and rhythmic movement to support trauma recovery. For example, the Trauma Drama program combines theater exercises with therapeutic interventions to help young people process their traumatic experiences. Participants engage in improvisation, role-playing, and storytelling, using theater as a tool for exploration and healing. The program creates a safe and supportive space where participants can express themselves, build confidence, and develop a sense of belonging. Another example is the use of drumming circles in therapeutic settings. Drumming circles bring people together to create music and rhythm, promoting relaxation and social connection. Participants in these circles often report feeling more grounded, energized, and connected to others. The act of creating music together can be a powerful form of nonverbal communication, allowing individuals to express emotions and experiences that are difficult to put into words. These communal activities are not just about individual healing, they also contribute to building stronger, more resilient communities. By participating in shared activities, individuals can develop a sense of collective identity and support. This communal aspect is particularly important for trauma survivors who may feel isolated and disconnected from their communities. Engaging in communal practices helps rebuild social bonds and fosters a sense of collective healing and resilience. In conclusion, communal activities such as theater and rhythmic movement offer powerful pathways to healing for trauma survivors. These practices provide a supportive environment for expression, connection, and self-discovery. By reclaiming their voices and participating in shared rhythms, individuals can break the isolation of trauma and reconnect with themselves and others. These communal practices not only support individual recovery, but also contribute to building stronger, more resilient communities. This holistic approach to healing emphasizes the importance of connection, expression, and shared experiences in overcoming the lasting effects of trauma. Epilogue: Choices to be made. The epilogue reflects on the journey of understanding and healing from trauma, emphasizing the importance of choices in the process of recovery. It highlights the progress made in trauma research and therapy while acknowledging the challenges that remain. This final chapter serves as a call to action for individuals, communities, and societies to prioritize trauma-informed care and support systems. Trauma is an inescapable part of human experience, affecting millions of people worldwide. Despite its prevalence, trauma has often been misunderstood and overlooked. Advances in neuroscience, psychology, and therapeutic practices have shed light on the profound impact of trauma on the brain, body, and mind. These insights have led to the development of more effective and compassionate approaches to treatment. One of the key lessons from trauma research is the importance of safety and stability in the healing process. Creating environments where individuals feel safe, supported, and understood is crucial for recovery. This applies not only to therapeutic settings, but also to homes, schools, workplaces, and communities. Trauma-informed care involves recognizing the signs of trauma, responding with empathy, and fostering resilience through supportive relationships and environments. Healing from trauma is a deeply personal journey that involves making choices at every step. Individuals must choose to engage in their own recovery, whether through therapy, self-care practices, or seeking support from others. This requires courage and commitment, as the process of healing can be challenging and painful. However, with the right support and resources, individuals can reclaim their lives and move forward with a renewed sense of purpose and connection. Communities play a vital role in supporting trauma recovery. By fostering inclusive and supportive environments, communities can help individuals feel connected and valued. This involves creating spaces where people can share their experiences, access resources, and build meaningful relationships. Community-based programs, peer support groups, and advocacy efforts are essential for promoting healing and resilience. Society as a whole must also make choices about how to address trauma. This includes investing in research, education, and policies that support trauma-informed care. Public awareness campaigns can help reduce the stigma associated with trauma and mental health issues, encouraging more people to seek help. Schools, healthcare systems, and social services must be equipped with the knowledge and tools to support trauma survivors effectively. The epilogue emphasizes that healing from trauma is not just about addressing individual symptoms, but about transforming the systems and structures that perpetuate harm. This involves challenging social injustices, addressing systemic inequalities, and creating a more compassionate and equitable society. Trauma often intersects with issues such as poverty, racism, and violence, making it essential to address these root causes in the pursuit of healing. Looking ahead, the epilogue calls for continued innovation and collaboration in the field of trauma therapy. New technologies, such as virtual reality and neurofeedback, offer promising avenues for treatment. Integrating traditional therapeutic approaches with body-based practices, mindfulness, and community engagement can provide a more holistic and effective path to recovery. The journey of healing from trauma is ongoing, and it requires the collective effort of individuals, of communities, and societies. By making informed choices and prioritizing trauma-informed care, we can create a world where healing and resilience are possible for everyone. The epilogue underscores the importance of hope, compassion, and determination in the face of trauma, encouraging all of us to contribute to a more supportive and understanding world.